that? Some days I have a yellow highlighter. That's the yellow highlighter. Some days when I was reading it, mostly read it on the airplane flying home. There is a value to a nice long airplane ride. Some days I had a green highlighter. And then I said, teasingly, someday Shirley loans me her pink highlighter. So you will find all kinds of different highlighting in here. Shirley, for those of you who have not figured it out yet, is the woman of my life. She lives here in Phoenix all the time. She's the person I'm flying home to or flying to Washington away from. And she's here tonight, and I'd like to thank her. Now, I want to divide this discussion up. I have discovered that talking about health care reform is a huge subject. There are so many different pieces of it that people get confused. So I'm going to try to break it up into some pieces. And I want to break it up by first by describing to you the pieces, and then asking you to tell me, and I'd like you to pick just one, which one of the pieces you think is of greatest concern to you. Let me start with a little history. There's some person over here who has a sign that I passionately agree with. It says, health care reform now. I agree with that, absolutely. I believe the health care reform system that we have in America today is in some ways fantastic and in some ways broken. But in the ways in which it is broken, it needs to be reformed, and it needs to be reformed now. Now, I'll tell you why. Because some of the ways in which it's broken is hurting people very badly. It's costing too much money, and it's leaving people out of the system. And by gosh, I have wanted to reform healthcare since I got to Congress in 1995. When I first arrived in Congress, I began working on the Patient's Bill of Rights because I thought a number of HMOs in America were cheating people by denying them care, not because they didn't, for medical reasons, need the care, but for financial reasons, the insurance company didn't want to pay for the care. So I started working on a Patient's Bill of Rights. We didn't succeed in passing that legislation, but I think we did succeed in forcing the managed care industry to stop cheating people or to at least quit the flagrant practices of denying people care. There are two other issues that I feel passionately about in terms of needing reform. Those are pre-existing conditions and dealing with the uninsured. But one of the questions comes, okay, you want health care reform. The next question is a little tougher, and that is, what's the right reform? How do we fix what's broken without damaging what's good? I was in Los Angeles a week ago, and talking about health care reform, and a gentleman came up to me and said, you know what, I own a commercial building. If I discover that commercial building has badly broken plumbing that's leaking, I don't bulldoze the building. I fix the plumbing. And I would say that my approach to health care is we got to figure out what's working right and leave it alone, and we got to figure out what's broken and fix it. And I think that's a reasonable approach. Let's begin by dividing it into some issues. I'm going to propose 4 or 5 for you to think about, and then I'm going to ask you to just raise your hands and say, which one of these is your number one concern? All right? First one I'm going to identify is the cost of healthcare. The fact that healthcare in America, in terms of what we pay for premiums and how much it costs, is going up dramatically faster than all of the other costs in our economy. No other sector of the economy are costs going up as quickly as in healthcare. They're going up much faster in healthcare. So many of us are worried about, okay, I have healthcare today, but I'm worried that it's getting so expensive that my employer will drop our healthcare plan tomorrow because it's too expensive, or I won't be able to afford my portion of my employer provided plan next year because it's going up too much. Or I'm in what's called the individual market, where I buy my own plan, and I'm afraid that the premiums are going to get too expensive. So point number one is cost. Cost going up too fast. Second, I want to talk about the issue of what I would call the unfortunate Americans who have a chronic condition, or what's sometimes referred to as a precondition. My older sister has breast cancer. You may have read that in the paper. She would be somebody considered a high risk and somebody with a pre-existing condition. I have both a neighbor and a friend who have MS. We probably all know someone who has AIDS. We all know that in the last presidential election, Elizabeth Edwards had breast cancer. And we know that John McCain has skin cancer. Those are chronic conditions that are very, very expensive. So I guess the second question, first is cost. Second is, we'll call it pre-existing conditions and chronic conditions. Think about that one. Third category are the uninsured, the people that have no health care at all. They don't have employer-provided care, and they either can't afford to buy health care for themselves, or they choose not to, which is a number of Americans. We'll call that the third category. Those, I think, are the three biggest categories that are worth discussing. We could talk about other topics, but I think it's pretty well divided into those three major topics. I'd like you to just help me by saying, just picking amongst those three, what your number one concern is. If your number one concern is the cost of health care, the fact that it's going up so quickly, please raise your hand. Okay? Second, if your number one concern is either preconditions or chronic conditions, you know somebody that has a condition and they've been denied coverage because they have that condition, or they've been told that health care will cost them, 10 times what it costs a healthy person. If preconditions and people not being able to get insurance because they have breast cancer or MS or a very expensive condition, it could be AIDS. They can be treated with today's phenomenally effective drugs, but are very, very expensive. If pre-existing conditions are your number one concern, please raise your hand. Okay? Third, if your number one concern is that we don't cover everybody in America, and here's where you hear the number 48 million uninsured. That number actually bounces all around. A year ago it was 40 million uninsured, then it crept up to 44, then it crept up to 47. Now they're saying it's 48. Some people say it's 50 million uninsured. When you take that number apart, many in the audience probably know that many people say that number is not accurate. Many people say, for example, that the Census Department will tell you that it doesn't mean there were 40 million or 47 million Americans who were uninsured for an entire year. We'll say 2008. What it means is that there were 40 million Americans who at one point in 2008 were uninsured. They might have been uninsured for a day, or a week, or a month, but they weren't uninsured for the whole year. If the uninsured are your number one concern, please raise your hand. Okay, fair enough. What I want to do now is kind of take apart the issue of healthcare reform in those three categories and talk about how we can fix them. And I would like to suggest that two of them are relatively easy to fix because by and large in Washington, even though the House bill was not a bipartisan product, the House is generally not very bipartisan, especially when one party has as big a margin over the other parties as exists right now. But the Senate is more bipartisan, and the Senate, I think, will produce a more bipartisan bill when they finally get around to doing it. But I want to talk about the fact that two of the issues we've talked about so far tonight, chronic conditions or pre-existing conditions, and the second one, covering all Americans, I want to suggest to you, we as a nation have already come to agreement. And that I think finding a bipartisan solution to those two issues is relatively easy. And I think, in some ways, we've already resolved it. Every Republican bill I know in Washington And every Democrat